keeps moving. Okay. Good evening. Thank you so much for joining us on our Zoom presentation for our webinar. Tonight, I am very happy to introduce Ms. Lisa Bersaje. She is our in-house massage therapist, shares space with us. She's going to talk to us a little bit about what she does. For those of you who don't have the opportunity to get a massage, you may want to give her a holler. But without further ado, I'm going to get out of the way and let Ms. Lisa talk to
you. Good evening. Thanks for joining us. We're going to do this presentation a little bit different than I did last time. I dropped a lot of research aside, which I still will, but I'm going to have some fun photos and different things. I'm going to kind of explain the different modalities I do.
Give me a second to finish moving. They moved a screen on me.
Oh, okay.
There we go.
All right, so first slide, Healing Time with Lisa, name of my business.
Whoops.
Oh, that's good. That's good.
No. Sorry about that, folks. The man behind the curtain is messing things up.
Oh, you're good. I don't need it. I got it.
Okay, now you just use the down arrow right there.
Okay. All right. So I wanted to start off with a cute little comic. The original Nokia phone. I wish my body were as tough as that original Nokia I had. And so I'm going to start off with a little background information, because if you're anything like I am, I know when I'm looking for a CranioSacral Therapist or someone who does like Pnf Stretching, you know, I vet them out, I Google them, I make sure that's a good fit, make sure they do good work, I look what classes they've taken, you know, how much experience they have. So I just totally vet it out, make sure it's the right therapy for me. So as you can see, my LSU graduation picture, the one on the right is actually Upledger Institute. I am a teaching assistant for the Upledger Institute, and then a cute little picture, Doc and I, and my little gift card basket. All right. So just a little background information. This is my son, Trey. This was his 9th grade year. He played tuba. The seniors called it Big Nasty, the tuba, because it's bigger than the freshmen that carry it. So that was my son from his freshman year in band. And the next slide, just influential people in my life. On top, I have a picture of myself, Dr. Micah Richards and Dr. Ken Coleman. I was with Dr. Coleman for a little over 6 years, and I tell you what, chiropractors make the best massage therapists. He did some amazing training with me. Mike is the one that taught me all the Pnf stretching, proprioceptive neuromuscular facilitated stretching. Ken just taught me some amazing neuromuscular work, for which I'm very thankful for. And then Doc and I, we were at a conference in Indianapolis for Nature Sunshine, just learning the science behind the products that they offer. And then the other side is Chico and I. He was LSU cheerleader, LSU cheerleading coach. He's given permission to talk about him. He does have a GoFundMe charity. He was a boating accident, which is how he ended up quadriplegic, and he is one of my, we do a lot of CranioSacral Therapy, and we do also do muscle work for the muscles that are still functional above C3. All right. More fun slides. The one on the left is I was in a cave in Fuego called Explore. The picture on the right was a little more spiritually enhancing. I was in Machu Picchu. We actually took a train from Cusco, and it was amazing, amazing experience. The altitude, the clean water coming down from the mountains, it was just amazing. I didn't put it on here, but we went into the Sacsayhuaman Valley where the original Mayan remains were. And we did get to see the Mother Earth Pachamama temple. We couldn't actually go down to the structure, the temple, because the ground is starting to give, so they don't want a lot of people out there, but we could look down upon it. So we're up in the Andes Mountains. Next one. Okay, so this is a fun picture. On the left, so this was 2009 on the left in Gonzales. They're really amazing memorial Veterans Park that they opened up. This was 2009. We did a 21 gun salute on the second one. And the picture on the right was from Afghanistan. I was deployed in 2002, 2003. I was in Bagram, Afghanistan, the airstrip, the airport. So I did retire, actually did retire from the Louisiana Army National Guard with 20 years and 2 months in 2011. So it's a little background information about myself before I became a cranial massage therapist, CranioSacral Therapist. And then this is from while I was in the National Guard. I also worked for OPM, U.S. Office of Personnel Management. I did win a national award in 2007. And this is one of my, next one, this is one of my certificates from the Upledger Institute in Florida, where I'm a teaching assistant. And I love the Upledger Institute because they take folks from all different backgrounds, all different medical fields, and we sit in class together. So we'll have RNs, MDs, OTs, PTs, chiropractors. We even had a preacher in one of the classes because ministers are allowed to put their hands on people so they can, and they have a college degree, so they come sit in the class with us. That's a little information, a little background information about myself. And next, so I'm going to talk about the differences in the modalities I do. So when most people think of massage therapy, they think, deep tissue, get in the muscle, you know, or a nice Swedish massage, you know, a lot of effleurage, gentle Swedish massage. That's what most people think about. And in doing so, you're working with the peripheral nervous system. And I also do the CranioSacral Therapy with the Upledger Institute. And with CranioSacral Therapy, we're working more with the central nervous system, and we're also trained in tipular mandibular joint, TMJ massage, and we also do some visceral work, which just means we work with the organs. So again, central nervous system, brain and spinal cord, peripheral nervous systems consist of the nerves and ganglia outside of the brain and spinal cord. So just to kind of differentiate. Another cool picture, give you a better idea. So again, the nervous system, brain and spinal cord. And with the peripheral nervous system, you have voluntary, involuntary. So involuntary are the autonomic nerves, controls your heart, respiration, digestion. Somatic is, for instance, muscle motor and sensory or senses. So it just kind of helps you, you know, gives you a quick review so it kind of differentiate between the modalities and nervous system. So we're going to start with, this is one of the popular ones. Sometimes I combine it with CranioSacral Therapy. I'll do a hot stone and then we'll go into CranioSacral Therapy if it's a 2-hour massage. So the hot basalt stone, they are volcanic stones. A lot of times, like I can always tell where people hold stress. If I have someone, even if it is related to the accessory nerve, the central nervous system, and I see them come in with their shoulders up to their ears and just holding that stress, we'll start. A lot of times we'll start with the hot basalt stones. It's a really smooth surface. They stay hot, and just like melt the muscles. They literally melt the muscles. You know, it's not the deep it's not the painful deep tissue. It's just melting the muscles and getting really good circulation, red blood cell flow, helps oxygenate the cells. So this is probably one of my favorites just because, you know, it immediately relieves a lot of that muscle tension, especially when they carry it in their shoulders or any other area of their body. It's just very soothing. And I also pair it with, like for instance, the music. I'll use 432 hertz, which is Schumann's resonance. It kind of, it brings in that peaceful flow, because the music right now is generally 440, which is kind of a chaotic frequency. So I bring in the frequencies too, usually either 432 or 528 megahertz. Just adds to the comfort, the relaxation. I also do a lot of Pnf stretching, Thai yoga stretching. I actually took a lot of my techniques from partner-assisted stretching and yoga, and I adapted it to the table. I've also taken several classes, Thai yoga classes. So on the left where you see it says stretching. So I use the hamstrings as an example because it's a large muscle group. And as you can see, the little stick figure is being stretched. So basically, like it says on the slide, when I do Pnf stretching, it's, you know, I passively stretch, then I have them contract and resist against my pressure, and then I have them release the pressure, and it gets a deeper and deeper stretch each time. Works at the Golgi tendons, you contract and release, and it's easier to get a really good stretch. And on the right, I show, my slide shows the trigger points. This is just, again, another example. Because a lot of people do come in with piriformis syndrome. So I have the trigger points listed on there. So in trigger point work, same concept, with the passive stretch, contract and resist and release, and you get and we do that with the trigger points to release the piriformis so it's not pressing on the nerve, the sciatic nerve. And a lot of times, I mean, sometimes this is all people need. If I have a young person come in, their hamstrings are super tight, and then, you know, we kind of work things out, you know, they may not need to work with the central nervous system or do anything else. That may be all they need is the neuromuscular with the stretching and hot stones. So the next one, CranioSacral Therapy. This is what I actually specialize in with the Upledger Institute, where I'm a teaching assistant. So it originated in the 1970s with Dr. John Upledger, and the program derived from osteopathy. So, and he did most of his research at Michigan State. And then he brought all his research to and opened up his own research and practical application clinic in Florida, where he still continues to do the therapy. So it's basically a light touch, very light touch. It's energy meets science. So if anyone's read or studied Tesla, you'll probably be able to understand a little more. So it's energy meets science. I'm going to go over it a little bit more. Here are some of the books that Dr. Upledger has written, a little more background information to vet him out. Oh, and he did win academic fellow at the British Society of Osteopathy and a Doctor of Science. A lot of publications of Medicina Alternativa, if I pronounce that right. Okay, so this is his background information. Go back. So basically, again, with craniosacral therapy, you're working with the central nervous system. So you're basically getting the fluid moving through the ventricles, sinus cavities of the brain, down the dural tube, and back up. You're opening up channels, which helps with the cranial nerves, kind of open up the cranial nerves, getting the fluid flowing. Motor nerves are like a little electrical wires. So if you have good continuity and you have good flow, you know, electricity moves pretty quickly through water, and cerebral spinal fluid represents like that fluid that the motor nerve signals run through. So if you get things flowing good in the central nervous system, the meninges that are inside the skull, the meninges line the inside of the skull and the inside of the spinal column. And they're just vascular, spongy material. So we basically release any impingements along the spine, get the fluid moving in the head to open up structures and get the signal, good continuity down the spine. And here's a list of things it treats for babies as well as adults. My youngest patient is 6 years old with autism, treating him now. Other than that, some of the main things, probably the top 3 things I see, you know, issues people have when they come to see me. I see a lot of TMJ issues because people tend to hold their stress there in the temporomandibular joint. I see a lot of people who come in with migraines. I've treated tinnitus, and I'll go a little bit further than that and later in the presentation. A lot of fibromyalgia because they can't handle, you know, deep tissue or anything painful because proprioceptors are quite sensitive. And brain injuries, TBI, traumatic brain injury, spinal cord injuries, just try to open up structures, TMJ, Alzheimer's, and also issues with babies. So I mentioned earlier TMJ issues. So I pulled out this slide. It's actually Karen Axelrod's slide. It's one of our treatment slides. And if you kind of look at it, when we're treating TMJ, you could see where the temporalis on the side of the head, the masseter, where everything's located, and how, and a lot of people, the last tinnitus I treated, his temporal bones, you have 2 paired temporal bones, and as the fluid in the head expands and contracts, flexion, extension, everything kind of expands, the temporal bones move and sink, flexion, extension. It's very, of course, I'm exaggerating the movement right now, but they should move in flexion and extension towards the feet as the head expands and contracts. And a lot of times, like the last one I treated for tinnitus, his temporal bones were out of sync and it was setting his jaw in a really odd position. And the one that was torqued the most, the temporal bone that was torqued the most because of the membranous structures, the bones were fine, it's just the membranous structures were pulling it. Once we got the temporal bones in sync and loosened up that area for cranial nerve 7 and 8 to pass through, cranial nerve 7 is facial nerve, cranial 8, vestibular cochlear nerve. So once we opened up the area where the nerves pass through, anterior to the mastoid process, and kind of opened up that area and the meninges and all the membranous structures, it started to back off, the tinnitus started to back off, and eventually it went away. So it was just the way the structures were, and it was pressing on cranial nerve and cranial nerve 7 and 8. So, you know, that's just one example of treatment I've done for TMJ. I've also treated olfactory nerve. I had a lady who was exposed to chemicals at a chemical plant. So we treated, you know, you have olfactory bulbs. Cranial nerve 1 is kind of interesting. It's a direct fibrous connection to the brain. So it has a lot to do, you know, it has to do with smell. Olfactory is smell. That's why we have so much memories. When you associate with something, it connects that memory. This memory of smell is predominant, you know, we go back through our memories because it is that direct fibrous tract link. So basically for the last patient, I just opened up the space anterior to the mastoid process So cranial nerves 7 and 8 were being impinged and they could do their job. Again, cranial nerve 8, vestibular cochlear, the inner ear, it's a nerve to the inner ear area. And it helped open it up so it wasn't pressure in the ringing. And I also treat a lot of migraines. When you basically get the fluids moving, especially there's a lot of stagnation, get the glial cells activated so the brain can get rid of all the metabolic waste, it can function better. Same concept with like when people have heavy metals in their brain from various things they've been injected with or whatever. It kind of gets everything moving in the brain, the cerebral cortex, so you get the heavy metals, try to get them moved around, flushed out, get the glial cells working, so clearing out all the waste. It really, it's phenomenal therapy. We're just opening up the structures of the central nervous system. Okay. And I will do questions after. So if I go through a little fast, let me know. So again, craniosacral therapy, balancing the rhythms of the mind and body, because there is also somato-emotional aspect to it. The way our brain imprints, memory, emotions with memory. And I am trained in somato-emotional release therapy. That's part of the craniosacral therapy is the somato-emotional. Now, the next example I wanted to use, and this research comes from Israel. So it's something that was done previous to Dr. John Upledger with the Upledger Institute. So this is just previous research that he was aware of, and he just took it to a new level. So in the example here, I have Igor Sharkovsky. He was assisting in a 20,000 an underwater births. He did 20,000 of them, and eventually began experimenting with women giving birth in the ocean. And again, this is 1979. So basically, and you could read through it, he did the water births so that the baby will have a more gentle emerging into society. They basically go from a water sac to the water in the ocean with the dolphins, and then their first breath is far less traumatic. Because again, when you bring a baby into the traditional system that we have now, they're yanked out with metal forceps, they're twisted, they're torqued, they're traumatized, and then you yank them up and, shake them around. And it is traumatizing, and you're basically imprinting that trauma in their brain. So there are better ways to do something. At the Upledger Institute, there's a ton of research, because like I said, they have a clinic and a research facility. And, where they go over the different, and we actually do the therapies. So again, it's actually called Aquadural Birth. It's been done since 2700 BC from the women in ancient Crete. It's been used in Japan, South America, various countries, and the indigenous people of New Zealand. And they're known to birth in either shallow ocean or rivers. So I mentioned the limbic imprinting earlier. So we want to make sure when a baby comes out, they, exposed to as little trauma as possible, since they're imprinting on the limbic system, which is the emotional part of the brain. And we want that nice, calm transition. When you know better, you do better. I wish I would have known this 24 years ago. So here's another picture, and this is actually Dr. Upledger's work. They have in the Bahamas, they have an area where their patients, they do therapy in the water with the dolphins and the patients. They actually started out with autistic kids. Because the dolphins, they have that sonar radio, and it actually calms their brain into an alpha wave, 5 megahertz. Yeah. And it puts their brain in a calmer state, the autistic children. and they really enjoy the therapy, the stimuli. It's not too much for them. It's just amazing therapy. So we have CranioSacral Therapists and the folks that they're treating, and the dolphins participate in the treatment as well. I do have the dates for the upcoming therapy in Bahamas. They have certain days they do it on. I listed those, and you can find those on the Upledger Institute website. This slide, I just want to give you a quick review of anatomy. I want to speak about the limbic system, where it is in the brain, the thalamus, the amygdala. The thalamus is like the little relay center. It relays the message to the cerebral cortex. So that's why it's really important, if you're going to have your first imprint, that it's not traumatic. Thalamus, amygdala, hippocampus, cingulate gyrus, fornix, and the parahippocampal gyrus. And also it regulates the autonomic or endocrine function in response to emotional stimuli, and is also involved in reinforcing behavior. Again, so why it's so imperative that we bring children to this world in a better way. You know, we know better, we do better, and we're imprinting on their the entire system. So, all right. And this last slide. So on this slide, you can take a picture if you want. I have the web page for the Upledger Institute. It's actually IAHP, International Alliance of Healthcare Practitioners, because we are a special group. You know, we have people from all walks of the medical field, from, you know, RNs, PTs, OTs. We had a preacher once, massage therapists, and, you know, basically anybody with a college degree and a license to put their hands on people. So I've talked quite a bit. I didn't bore you with too much research. I wanted you to be able to vet me out. And I am doing gift cards. We are selling gift cards for the holidays at the office. And I have free gift boxes. You know, if you buy a gift card, so you just stick it in the box. It's labeled. It's ready to go. And it is nice to get a gift, you know, healthy, a gift of healing, a gift of health. And we have those at Dr. Danton's office. I went through this pretty quickly. There's a ton of research. I could go on for days about the research. Like, we have Dr. Upledger does free therapy, and he has a fund set up for veterans with like PTSD, TBI. We've done a ton of research with that. Basically, patients who've been to the VA, they've had MRIs, all kinds of scans, and they don't find anything, they'll send them to the Upledger Institute for treatment, and they are treated for free with a grant. We also they have a ton of research on Alzheimer's and basically getting the heavy metals out of the brain. And I think I went over that last time. So there's a ton of research. Like I said, I could talk all day. So right now, I'm just going to open it up to Q&A. If anybody has any questions, go ahead and feel free to raise your hand, chime in. If I don't know the answer, I'll research it.
You don't know the answer, you could be like the government.
Yeah.
I didn't say that.
Oh, okay, should have everybody unmuted now that wishes to be. You can also press the space bar on your computer keyboard, and that'll unmute you while you hold it down, kind of like a key switch. So if anyone has questions, they're more than welcome to chime in.
Could y'all go back to the slide that has babies and adults with all the different things that craniosacral helps with?
Yeah.
Yeah, that one.
Okay. You have any questions, or you just want a picture?
Well, my granddaughter is having some physical developmental issues. And I was wondering if craniosacral would just be for mental developmental delays or also physical developmental delays.
We do have the motor aspect to the brain, cerebellum. So I'll just give you an example. I'm treating a 6-year-old right now with autism. And a lot of the lesions are on the left side of the brain, which deals with language. And even though he was way ahead of other children his age with autism because he's bilingual, he should have been able to better make those connections between the language and speech part of his brain and verbalizing it. So with him, it was a lot of, he had autism, and his mom said it occurred, he was normal, and then it occurred after the vaccine, so he had a lot of heavy metal. So his doctor was doing the chelation, and and then I came in with the CranioSacral Therapy, basically got the fluid and the structures, the membranous structures moving in the brain to clear out the heavy metals, to further assist the chelation to get rid of the heavy metals. I've seen him 7 times. He's been with me for 7 treatments for 1 hour. When he first came to me, he was banging his head because of the lesions. He was banging his head. He was only sleeping like 2 or 3 hours in the night. His mom had to quit her job because it was just too much. After 7 sessions, we got things moving, the membranous tissue, the fluid, good fluid movement, kind of breaking up those lesions and the heavy metals. He no longer bangs his head, and he's able to form sentences better, and he's still working on that to connect the language to the speech. So he's still working on that aspect just because of the damage that was done, but it helps get things moving so that he's not banging his head in pain. So that's where we're at now with my 6-year-old.
And Anna, you were saying your grandchild has, mentally, she's meeting their landmarks, but not. I think that you said the brain wasn't growing as well.
Well, no, that has changed. Her head size is growing. The problem is that she's almost 8 months old and she can't turn over or doesn't turn over.
Was she a C-section or a vaginal delivery?
Yeah.
Well, it certainly wouldn't hurt for Lisa to see her and see if there is some little kinks that might have occurred with the delivery that she could help with. So certainly getting her in for an evaluation wouldn't hurt anything.
Okay. Well, I just didn't realize all the things that it can help babies with.
And tongue-tied, it helps tongue-tied and other issues within the mouth, like that they're not able to suckle, and things of that nature as well.
Okay. Of course, right now she is teething.
Yeah, definitely worth getting it checked out, because it's one thing about the practitioners in the office. If they can't help you, they let you know. And if they can, they'll work with it.
All right.
Awesome. You just call the office number and we help make those appointments for Lisa.
Okay.
Does anybody else have any questions? No, she did such a great job that y'all know everything now.
Do you have a story about helping somebody with dementia?
Full-blown dementia, no. Usually by that time, they don't want to sit still long. So that I have not. Well, actually I have partial dementia, not full-blown, but and it did, for the patient that I have, he was in a wheelchair. He had a stroke. He lost all feeling on one side, on the left side. So when I would do craniosacral therapy for him, it would just make him relax, and he felt better. There were changes within the memorable structures in the brain. But before he passed, was working on, he was 80, mid.
Hi, Gloria, I'm listening to this lecture. Michael has autism, or what does he have?
What?
And so, what is their treatment?
I think we're getting the background that I don't know if Gloria's meaning to talk to us
Oh,
or if
okay.
she's on another line.
Did that answer the question, or
Yeah.
because it can make their
well,
life
I
a lot
know, but if
less.
there's a question I can ask, I'll ask, and then
Back, get back.
anyway, talk to you later. Bye.
Oh,
You can right click on them and you can mute them if you need to.
Okay.
Okay. Any other questions? And what we can do too is we can turn off the recording at this point. Let me kind of get where maybe I can be seen.
Yeah.
And thank you all so much for being with us this evening. And
Thank you so much.
got some great new information that I hadn't
Thank
really
you.
thought